Vital signs. Alongside any PHQ-9 assessment, you would also be expected to perform some vital signs on the patient. The observations form will usually look something like this, although paperwork can vary, so if it looks a bit different, don't worry, the core elements will be the same. Be sure to check the patient's demographic details at the top of the chart are present and correct. If they are not, you will need to fill out this information. As usual, the BP is recorded by marking a dotted line between the systolic and the diastolic pressure. The score shown here is the correct way of marking a blood pressure of 100/80. The temperature is marked with a dot that aligns with the temperature markings down the right-hand side of the observations chart. The pulse is marked with a dot that aligns with the scoring on the left-hand side. If the pulse rate was 80 beats per minute, but the diastolic pressure was also 80, you would just need to mark the dot next to the arrow as shown. The respiratory rate would simply be written at the bottom in the box provided. Before taking the OSCE test, we suggest you practice recording example observations so you feel comfortable with the observations form. Our top tip to save time when conducting observations is to do some of the observations at the same time. For example, you can take the patient's temperature whilst taking their blood pressure, or you can take their temperature whilst taking their oxygen saturation level. Don't forget to perform hand hygiene after disposing of the temperature probe in the clinical waste bin. Remember, if any of the vital signs are too high, you would need to monitor according to the NEWS 2 thresholds. Ending the assessment station correctly. Whatever the health issue the patient has presented with at the assessment station, there are a few steps that you need to perform before leaving the patient. It can be helpful to remember this as the 4 Ps. Position. Are they comfortable, or do they need any help moving? Personal care. Is there anything they need, such as a refill on their water jug or assistance going to the bathroom? Property. Have you addressed all of the props in the room? Pain. Have you checked their pain score? If they need pain relief, then you should tell them that you will check their notes to see if they're due for any more painkillers. Before leaving the patient, you should state your follow-up plan and any actions. This should include the frequency of their observations, if you are intending to escalate care, any risk assessments you are going to perform, if you will be referring them to any agencies. There are some standard risk assessments that should be considered as part of the assessment process. If the patient has mobility issues, they should be referred for a falls assessment within 6 hours of admission. If the patient cannot move independently, they should be referred for a pressure prevention assessment. If the patient is at risk of malnutrition, they should be referred for a nutritional screening assessment within 24 hours. It is not essential to mention these in the assessment process, but you can do it if it is relevant. By the end of your assessment station, all of your observations, along with the patient's ID, should already be documented. If you ran out of time, you can verbalize anything you would have explored with the patient if you had further time. Often, it is through probing conversations that you will find out more about the patient's individual needs and which ADLs are being impacted in the current situation. This contextual information will enable you to treat the patient as a whole. In fact, being able to communicate effectively with the patient in this way is a critical skill in UK practice and is something you are evaluated on closely in the OSCE test. In your OSCE exam, it is highly likely that the patient will reveal important information to you if you probe their situation a little more deeply. There is not one right way to probe the patient, but the patient overview information and OSCE scenario information can provide some important points that you could use to initiate a conversation. For example, if your patient is an elderly person who lives alone, you could probe further to understand if they need any additional support with their ADLs of maintaining a safe environment, mobility, washing and dressing, or eating and drinking. If there is a walking aid in the room, it is a clue that you could talk to the patient about their mobility. Or if you see some junk food on the table, it can be an aid to help you explore the patient's eating and drinking habits, so you can understand whether or not the patient is eating a healthy diet on a regular basis. If there is something that needs to be addressed, such as a patient's anxiety about their pet, it will keep coming up again and again in conversation. If this happens, don't ignore it. Acknowledge it and say you can't solve the problem straight away. Demonstrate empathy and explain how you may be able to assist after the assessment process has taken place.